Topher. I work in community outreach here in Riverside, and I'm here today with Amanda George. Hi, Amanda.
Hey.
Amanda, I'm not sure how long you've been here. How long you been here?
I've been at Riverside actually coming up on 9 years. I'm on my 9th year. So
Okay, right on.
Yeah, almost a decade.
I guess we'll jump right in and just say, 9 years.
Yeah.
What's been going on during those 9 years, and maybe a little bit of lead up to those 9 years? Like, how'd you get here? How'd you start?
Yeah. So I come from a background, my family, they're all helpers, community supporters. And so actually my mom's a therapist. So I grew up with a lot of mental health talk in the house. It was a very open conversation. It was things that I benefited from personally in my own life, like learning those skills from an early age. And then I started my career in the school counseling world. So I did a few internships in college where I was working in the school system and really kind of developed this passion for universal mental health, right? Like the idea, there's kind of a couple routes you can go when it comes to school counseling. You can kind of have more of an education background or education, I would say identity, and then a more mental health identity. So I went to school, started in the school system, got my licensure, and did my residency in the middle of my first few years of school counseling, just like very like focused on, I want to provide everybody to have access to some level of mental health care at the school system. And so as that developed over time, I did both jobs jointly, private practice and school for the last 8 years. So that's been a lot. And I kind of just came to find that, we have a really community approach to supporting kids in the school system, right? If one student is struggling, there are, 10 adults supporting them at that time who are trained, who have the background to do so. And as I'm working with families, that's not the case for them. They are often feeling isolated, like on an island. They don't have a support system. They don't know what to do next. They take their child to therapy and the child is in a session, but then they don't feel informed about how to support them moving forward. And so I found as kind of time went on that there's this big gap too in the community mental health world for supporting kids in kind of a more private practice setting. So I'm making that transition full time actually this summer, just saying goodbye to the school system. And here we are.
That's super cool. Well, I mean, that's I would assume really good training and exposure and kind of muscle building within being able to help in all sorts of situations within the school system. So if you could kind of what from that school system environment, what has it equipped you with, I guess, from spending a decade in that environment?
I always kind of joke and say like the number one thing is just to be unflusterable, right? I mean, at the end of the day, when you're serving an entire community, I've had 11 years of school counseling. So I've had thousands of kids and thousands of families right at this point. And there's not a lot you don't see. There is a surprise every year. There's something you're like, I can't believe I'm seeing something new. But at the end of the day, most things, you're getting a lot of exposure to a lot of different kinds of mental health, people in different journeys of mental health, also different age groups, right? So my primary community was elementary children, but with that comes serving your teachers and your administrators and your parents. So you're serving kind of this full range of age group and people in all different walks of life. I think the school system also prepares you really well to respond to crisis, which is one of kind of my areas of expertise. I do, when people are in crisis of some kind, either mental health, we see a lot of behavioral crisis, even like aggressive behaviors for children. Like there's a lot of training that you get at the school system level, suicide screenings, threat assessments. There's a lot of protocol and safety protocol that happens in the school system around those things that very much, if you're walking into your first time in private practice without any of that, you're experiencing it more slowly, right? Like it's not your day to day. experience. Whereas when you're in a school system, sometimes it's every day for a week, and you're quickly getting to know how do I respond to crisis, remain calm, present, and be effective in that kind of setting too.
Huge. That's huge. And like you said, it's kind of a muscle that gets built over time to be able to be effective in the moment and stay present there, and to see it through to, the best case scenario. That makes a lot of sense. Yeah. Well, that's cool. That's cool. I mean, I think a lot of folks that will visit in private practice will benefit from that, from those years of, I won't call it being in the trenches, but it's a lot. It's a lot, a lot of quantity, like you said, a lot of depth and breadth of different cases and different mental health.
It is. Depth and breadth is a good word, a good description of it. It is wide range.
So within what I assume is a patient set for you, the folks that you help, children, teens, and families, their parents and the family unit, what these days, I guess, are and I'm sure there's through lines, from historical to now, but what's on your radar these days? What are people struggling with in the patients that you see?
I know, well, and this is a huge topic culturally right now. Childhood anxiety, adolescence anxiety has been on the rise for years. And it's, pre-COVID, and then exacerbated by COVID as well. So there's a lot of anxiety, and parents don't always feel equipped or know what to do to support that at home, right? I mean, you have your parenting skills, which a lot of those come naturally or modeled for you by your parents, but mental health skills are different, right? It's a different set of skills that have to be acquired. And so children and adolescents and adults, they need those skills personally, but especially children and adolescents, they're part of a system, right? Two systems, really, your school system and your family system. And they really need a supportive system in both places in order to progress quickly and start to feel better. So childhood anxiety, definitely, and just having parents know what to do. I mean, this is, again, our culture right now is drastically different than where most of us grew up, and our culture for most of us grew up to. There's a huge, especially when it comes to technology, a huge cultural divide, right, between the way I was raised and the way children today are raised. And so technology is a huge one, and how that affects mental health, both positively and negatively, I think, too. We often overlook the positives, right, because there's so many glaring negatives. But, the reality is, like, this is how kids are living, and how they'll work and function is going to be so heavily technology related. So I think there's a huge struggle in determining how do we help kids navigate that, right? And acquire the skills to regulate themselves, and also seek out positive experiences and avoid negative ones with technology, and use that productively moving forward in life, without all of the toxic components that go with it too, that lead to all that anxiety, depression, even some suicidal ideation in a lot of cases.
Is there, I'm thinking honestly, personally for a second, is there something, with my young kids and with folks that maybe don't see anything bubbling up that seems serious so far, preventative type, things that can stay ahead of these struggles. Maybe that's too big of a segue, but I guess when is the right time? Maybe when is the right time and to seek therapy for someone who seems like an anxious child, or someone who's dealing with depression and stuff like that at an early age. Like, when can we nip it in the bud sooner, so to speak?
Yeah. I love that question, because my response to anybody's, even when I was working at schools and making referrals out to the community, teens and children are so flexible. And they're like sponges, right there. And you do get your resistant or reluctant ones that come in sometimes. My mom said I have to come to therapy. And then they're really motivated to feel better, though. And they are also in the habit of learning, right? They go to school every day, they learn, they acquire skills. And so the sooner they learn and acquire mental health skills for their, support their day-to-day, the sooner or the less likely you're going to see those long-term effects, right? Because they're going to have the skills and we can build on them. They also know that it's okay to ask for help, right? You're modeling that, like, here's a safe person for you to make a connection with, to learn from. And then you have somebody, hopefully, that you can continue to come back to, maybe if life gets a little tougher sometimes, right? We go through easy spells and more challenging spells. Life is kind of this like up and down, right? I mean, it's not your same day to day. And it's the same way for children, teens, adults, like they're all trying to navigate the ups and downs of life. I don't know if that helps.
It super does. Yeah. And that flexibility that you talked about, and the ability to be with them, to show them some tools early in life, and to show them kind of that it's okay to ask for help. And that's kind of part of being a human out here, is being able to form connections with people that can help you. Like that, being at that sponge level, being introduced at that sponge level, at that receiving open level, makes a lot of sense. That makes a lot of sense. I think a don't wait approach would be, my takeaway from that is to just, introduce some helpful characters into their life, when there seems to be, stuff bubbling up maybe. So space protocol. I have no idea what it is, and it sounds futuristic, but what I have it in my notes that there's a certification that goes along with it, something that you did. What is that?
So SPACE training actually stands for Supportive Parenting for Anxious Childhood Emotions. So it is a program from Ellie Leibovitz, who is a well-trained and did a lot of research into this program. And essentially the concept is not all children and teenagers are available emotionally to participate in their own therapy. And that at the end of the day, when we look at research, providing parents with the tools, it's mental health tools for parents for anxiety, is just as effective oftentimes as providing it directly to the children and teens. So it's a very regimented protocol. So there's different steps. There's, I think, 10 steps in total. So we work through those steps a little bit at a time with parents. They do the learning. There is a lot of explaining to children and teens, like, we are going to this class to learn to help you. Here are the steps we're taking. So they're not totally in the dark. And they can participate in their own therapy at the same time in a parallel treatment, but it's primarily focused on equipping parents with what they need to help their children manage their anxiety if they're not available to make those huge changes, which is, quite frankly, very developmentally appropriate. At the end of the day, I think this idea that child goes to therapy, goes to session for an hour, and then is expected to be able to apply what they've learned all week long across settings, right? So they're leaving my office and they're going to home and they're going to school and they can magically apply all of those skills. That's not how we approach things in school, right? We teach them once and then we spend every day with them, right? Across the whole school year, reinforcing those skills, building, adding to it. And so SPACE protocol really gives parents the tools to do that with anxiety.
That's really cool. That's really cool. On the adult side, I mean, so obviously, you're not only treating, children. With the work that you do with adults, what stands out as kind of some of your specialty there, and who do you, I guess, primarily see, men, women, women choose, like what's popping up for you, and where do you find yourself effective in treating adults?
So I work a lot with women's issues, mostly with women. And a lot of the similar things, right? Themes that are happening for kids and teens are happening for adults too. Anxiety is on the rise. Support systems are lower and more isolated in the United States than they are in many countries. People are living further away from families, and that can create a lot of feelings of feeling isolated, like you don't have help. And I do see that with women often. We're talking about that have it all lifestyle that is beautifully presented in social media these days, but completely unrealistic. Either what you're seeing and behind the scenes, probably aren't matching up. And that's still the expectation that's being set, though, right? That we can be wonderful mothers, sisters, daughters, partners, business associates, coworkers, all of those things, and then still also have time for ourselves when it comes down to it, right? And time to take care of ourselves and feel good and present in a certain way to our families at home with all of that pressure is overwhelming. So I do see that often, and we talk about that often through the therapeutic process.
Yeah, that makes sense. Yeah, we've all moved away from family to find jobs or to do just what we wanted to do, and yeah, there's a lot of spread out, and I'm not I guess as much in a comparison mode as a man, but I do see those caricatures of life almost exposed on social media that look like, wow, she's super and super mom and super friend and super vacationer all in one.
Yes. I think everybody's had the experience too, where you find out what was really going on behind the scenes, whether it's, someone well-known or just a friend or family. And it's like, oh my gosh, that was not how that was presented at all.
Yeah.
And yet it still affects how we view ourselves and how we feel on a day-to-day basis and what we think the expectation is, even knowing what's presented to us isn't always realistic.
Super true. Yeah, we'd all do well to kind of carry that through with us really strong in the forefront of the brain, as we consume social, which just happens no matter what we do. It's going to be, it's part of life, but having that at the forefront is a good filter in which to see all that. So a little bit more into the clinical here just for a second. CBT or, and person-centered kind of behavioral stuff. I'm a novice, so I'm not describing it exactly right, but which methods, modalities maybe are, how do you choose what's right and what do you like for clients, and, what are your go-tos and maybe how do you apply based on who you're seeing?
So, my primary two modalities you mentioned, cognitive behavioral therapy. I use a lot of person-centered work, and really kind of the tenets of person-centered work are that, everybody deserves your unconditional positive regard. Everybody's trying their best. Everybody at the end of the day needs to feel your regard for them, right, in order to have a relationship. So that's really like a foundational component of therapy. At the end of the day, it really doesn't matter what modality I approach you with. If you feel that you don't have a connection, the therapeutic relationship is what determines whether or not we're successful. So that's an important way to kind of start. And then cognitive behavioral therapy are really evidence-based approaches where we're looking at how the brain, how the body affect how we feel at the end of the day, right? There are things that we can do that are, small changes at a time. They don't have to always be huge changes to help improve quality of life, feeling better on your day-to-day, and then working towards those goals together jointly as that we've set at the beginning of session. So it's kind of how I approach things.
It's cool to learn a little bit about you and what you're doing as you kind of open your time up a little bit versus, school leadership and school mental health and bringing it to the community at large now. For patients, or possible patients listening, what can they be doing to support their kids' well-being? In the meantime, I know you just you came up with a little ebook type piece on the website that had some pretty good tips in there, but like what can we be doing? I mean, it's summer now, but the school year is going to start soon enough, and what can parents be doing to support their child?
One tip that's actually a foundational tenet of the SPACE program, supportive parenting for anxious childhood emotions, and one that I just fall back on in general is just to remind parents to empower their child to use their own coping skills. We often are quick to jump in and soothe and reassure. And that's all a wonderful thing to do as a parent. You're emotionally available to your child. You're showing them that you care. You're helping them cope. And it's really important that children and teens learn to do that for themselves, right? So when you're tempted, when they're telling you, I'm really worried about school starting, I'm really anxious, I'm not going to have any friends in my class, our gut reaction is to say, of course you will. You're so good at making friends. You're going to make so many good connections. You are going to do great, right? We give them the skill. Here you go, and serve it up on a silver platter. One thing that I really encourage parents to do is ask, what happened last year, right? When you started school, how did it feel at first? And what happened throughout the year? Tell me about some friends you made last year that were new, that you really didn't bring with you from other grade levels, right? We're encouraging them to pull from an internal source as opposed to encouraging them to constantly rely on an external source of soothing and coping.
I mean, if there's just one takeaway from this, that's pretty strong. That's pretty strong. I think that makes a lot of sense because you're building in them instead of giving them something that they'll constantly need.
Yes.
They're strengthening themselves, and that's very cool. That's very cool. Well, I think that's the time we have for today, and I guess people can find you and reach out to book some time with you. And you'll be starting to have a little bit more availability soon, right?
Yes. So actually starting next week, I will be full-time at Riverside, 5 days a week. Please reach out, check out the website, and we'll see what kind of partnership we can make together.